Thank you, Ginny, for the talk on nursing as a career. Nurses have played a crucial role as frontliners in supporting the COVID pandemic, and we salute them for their support. Next, we are joined by the Dean, Dr. Tham, staff Amrutha, and an ENU alumni who will share information on the ENU nursing program.
Hi, a very good afternoon, and thank you for staying with us today at the MDIS ENU Open Day. Today we have Dr. Amrutha here with us to talk about more about the ENU programs, healthcare programs, as well as the nursing program. So she's going to share with us more information about the program as well as the insight of the healthcare industries.
Thank you so much, Dr. Tham. A very good afternoon, everyone, and thank you so much for tuning in for your time. I'm Amrutha. I'm an alumni and a staff currently working for School of Health and Nursing. Today, we are very excited to share a few insights on healthcare sector in general and ENU programs that are offered in MDIS.
Yeah. So, Amrutha, so with ENU, we have these two different programs specialized in nursing as well as the MBA, the global MBA program. So, as currently MDIS, what are the relevance of this program in the current situations or current era?
Good. Thanks for that question, Dr. Tham, which is very relevant in the current scenario because healthcare is changing rapidly. And ENU is one of the universities which offers very contemporary and real-time education that is very industry-specific to the current scenario. And I must say, we are extremely privileged to have partnered with ENU for BSc Nursing Top-Up program, as well as MBA Health Management program, which is completely run on an online basis for MBA program.
Yeah. Right. So these two programs provide the student with the flexibilities to studies as well to adjust their time accordingly because they're all online and you can do it on your own time, own target. So what is the, can you share more about the key features of the nursing program?
Sure. As mentioned, ENU is one of the globally recognized university which is ranked as, first modern university in Scotland. And in addition, ENU is one of the leading providers for nursing and midwifery education in Scotland. So we are extremely privileged to bring in the nursing program to Singapore especially. And I must say our nursing program is very relevant to the current nursing scenario in Singapore because, and also it's recognized by Singapore Nursing Board. So students are at very advantage to right after the finishing their graduation, they can immediately obtain the registration from Nursing Board and they can go into the workforce. In addition, because this students not only gain experience in nursing, but the modules offered are quite generic. I mean, students are gaining experience in terms of business aspects, also research, because research is crucial in nursing as well these days. So students are equipped with all these skills in our programs. In addition, because nursing is more clinical, hands-on experience is also crucial because they are directly dealing with patients out there. So our in-house nursing practicum lab helps students to learn a lot of clinical skills and improve their ability in real workforce.
Okay.
Yeah.
So those registered for this program, are they practical nurses or can they come as a fresh graduate or at a A-level, or what are the entry requirements to the programs of the nursing?
Okay. This being a top-up program, we do accept students who are registered nurses in Singapore, who are already registered with diploma qualifications with Singapore Nursing Board. Those students are invited for this top-up program.
So this program is specially catered for working nurses who has already been in the industries with a diploma and registered with the Nursing Board?
Yes. Yeah. This is offered on a part-time basis, so it is suitable for working nurses to upgrade themselves with an undergrad degree because these days in order to have a career progression or to learn more about in-depth clinical skills, bachelor degree is at advantage for students.
Okay.
Yeah.
So I can see that we have the bachelor's degree in nursing, and then after that we have an MBA in healthcare management. So this will provide a pathway or progression pathway for our nursing students to join the MBA in healthcare management to expand their knowledge in the healthcare industries. Would you mind to share with us more information about the features of the MBA in healthcare management?
Sure. As rightly said, this provides a pathway program for our nursing students to progress onto MBA program. And one of the key advantage here is this program is completely delivered online. So it's very flexible and any of the working individuals, be nurses, no, other healthcare professionals, any other professionals who aim to switch to healthcare career, ENU MBA program is for them. Because this program deals about general business modules, but specifically focusing on healthcare sector as such.
Okay, so with the current pandemic situations, I see that there are huge demands of the healthcare professionals that we need to cater to the current situations.
Yes.
So, what are the challenges that, especially in the healthcare professionals or resources that they're going to face now?
Yeah, I mean, the present scenario is very unfortunate with the pandemic situation. You know, reporting of 4 million deaths across the world is posing a significant challenge on healthcare sector in terms of resources, manpower, finance. So it's very challenging. And in addition, if not pandemic also, if you can see, healthcare sector is ever changing, it's never constant. So there are a lot of innovations happening in healthcare sector, a lot of changes with digitization happening. As we can see, there's no more traditional approaches in surgery. It's all robotic assisted surgeries nowadays. There are a lot of new innovations, like when you are visiting a hospital, we do have robots taking temperatures now, robots operating surgery. So there are a lot of advances. It's crucial to cope up with these challenges, and moreover, as we all know, world is aging, so there's increased aging population across the world, demanding more and more healthcare professionals for coordinating the care. Say if a diabetic patient is admitted to hospital, patient has to be treated in the hospital, has to be focused, has to be, coordination has to be required for polyclinic, general practitioner clinics. So this integration of care is crucial.
Okay, so now we're talking about the integration of care. As you mentioned earlier, the part of the aging populations, I think not only in Singapore we are having these problems, but how do you see these aging populations and how the healthcare or how the healthcare structures of our healthcare system can support the aging population as well as to cater to the rest of the health problems or issues?
Yes, as we know, like by 2050, world's population is going to be 50% aged above 65 years of age. So this is a really crucial point to consider for healthcare professionals. And as we can see, this integration of care is crucial because with age is often associated with more and more chronic diseases. Chronic diseases is never like one-time care. It requires a continuation of care for them. Monitoring is crucial. So and moreover a multidisciplinary approach. That is, no more a doctor can be okay to treat the patient. So there's a requirement of healthcare leaders, managers, clinical administrators to coordinate all this stuff. So there is as we can see with aging thing, there's huge demand for healthcare professionals and also advances in healthcare. We see remote monitoring for the elder patients these days, teleconsultations happening. Elder patients, because they're more risk for COVID, we're encouraging them to stay at home. But we can always consult them. The doctors are consulting the patients through teleconsultation protocols.
So as we move from the advancement of all these technologies, I believe that the basic healthcare, for example, the aims of the healthcare, the triple aims, or moving forward, maybe currently we have the quadruple aims to provide better healthcare systems or better healthcare support for our populations. So, okay, next one comes with what is the trend? We can see the trend is shifting. There's a lot of industries, aging populations, a lot of problems like the COVID now. So, what are the competencies or key trends for the healthcare professionals that they need to have to be able to stay on trend?
Yes, Dr. Tam. Because as we have just discussed on the challenges, healthcare sector is crucial with all these challenges, facing a lot of challenges now. In order to tackle these challenges, it's crucial we nurture our students with the competencies that are suitable for the next generations. How well are we prepared to equip students with the skills? So I'm glad to say our ENU programs equip students with all these competencies. Like, it's no more treatment for the patients, right? So our focus is completely on the preventive aspects, be it primary, secondary, or tertiary prevention. So ENU programs help students to completely focus on preventive aspect of healthcare, also nurture students with an important thing, that is collaborations and partnerships. So our programs are focusing on, focusing for students to develop these skills of collaborating between different agencies. As mentioned, now Health Hub is providing the information on diabetic status.
Yep.
Hospitals are taking that information and providing treatments for patients. So this integration of partnerships between different agencies is crucial in healthcare sector. So students are learning a lot of these collaborative skills. In addition, students are to learn about the technologies that are happening in healthcare sector these days. Yeah.
So I can see from what you discussed is that there are a lot of these hands-on practical things that happens around the healthcare industries. So in the program itself, so do you have the dedicated lab sessions or dedicated hands-on practice in the ENU program?
Yes, for nursing program especially, because nurses obviously directly deal with patients on first hand. So it's very crucial we equip them with the right practical skills during their undergraduate degree. So our in-house nursing practicum lab here at MDIS has nursing simulation mannequins. These mannequins will resemble the real patients in the hospitals, and they also can show them, show the students their examples of chronic diseases. It can show about diabetes, asthma, and many more chronic diseases. So students know how the stages of the diseases can be appreciated on the patient exactly, and provide the right care for students.
So while they're going through the practical sessions, so anybody is guiding them, or our own MDIS staff are guiding them, or the professors from ENUs are guiding them?
Okay, our nursing program and our MBA program are completely taught by ENU faculty with the support of MDIS. MDIS will always support them with all the value-added sessions that are required for those students. For nursing especially, because clinical skills is the priority there, ENU faculty would come down, fly in here, and show the students on how they can perform the procedures on the patient.
Okay, so they're all guided by ENU faculties who fly in all the way from Scotland,
to
Edinburgh,
Singapore.
to come here to
Yes.
teach our students, to guide them through all the practical sessions, to guide them how to identify the issues and things. So they're
Exactly.
all face-to-face sessions that they are going through in the practical sessions. But how about now, during this pandemic sessions?
Yes.
How are the students studying or coping with the studies?
Right point that you brought in, Dr. Tao. With the current regulations suggested by Singapore Nursing Board, we are conducting all the classes online, but showing students on the practical skills by demonstrating live sessions, because one of the advantages our students have is they are the working nurses in the hospital, so they know how to interact with patients and all. With the live demonstrations happening with the mannequins and with the patients from Scotland, students learn the in-depth skills basically through the live sessions. While for MBA, it is completely online. So ENU faculty is teaching them on different modules, which are specialized in healthcare, I must say, because business aspects in healthcare is very crucial for us to work in hospitals. A combination of clinical skills and administrative skills play a crucial role to optimize healthcare delivery.
So for online delivery or online program, the student support is really the crucial part. So does ENU or MDIS provide support for our students who study online, and what are the support kind of things that the student can have so that they can have a good learning environment and in their studies?
Yes, let me just go on the program basis. For nursing program, our team here at MDIS from School of Health and Nursing, we guide students throughout the procedures. Program is completely taught by ENU faculty, but we do guide them on their assessments if required, or we take in charge of all throughout the life cycle of program basically at MDIS. And for MBA Health Management program, there are value-added sessions that are provided by MDIS for each module, where students can clarify their queries on academic support. Also, not just modules, but we also provide support sessions on their academic requirements like critical thinking, workshops, LinkedIn workshops, such kinds, yeah.
All right. So as we mentioned earlier about the integrated health systems, so will this be also be a discussion in their modules, or in one of their modules or in the assignments or in the practical sessions to discuss more about the moving forward or the future of healthcare industries?
Yes. As mentioned, ENU MBA is majorly focused on business module, but with a specific focus on healthcare modules. So they do have very specific modules such as governance and accountability in healthcare, which focuses on how well we can integrate the healthcare systems to provide or to take charge of financing in healthcare systems, policy making in healthcare systems, because we never know when another pandemic is going to come, right?
Yep.
And we see World Health Organization is urging countries to spend more on healthcare systems. Health security is the key now. With the pandemic, everyone has learned the lesson, like we have to invest more on healthcare now. It's high time. So yes, our governance and accountability in healthcare module teaches all these aspects on how healthcare financing systems can be bettered, how well a country can formulate their policies, whether it's an organization or a country, any organizations, how well they can plan their resources to optimize the healthcare.
Okay, with the current technological advancement, so do you think the technologies will reduce the demand of healthcare professionals?
Good question. I think most of the students will have these queries. Technology is always an aided factor in healthcare. Technology never replaces doctors at the end of the day, right? So doctors are crucial. All the healthcare professionals, just not doctors, because as we have discussed, healthcare is a multidisciplinary. There are lots and lots of interactions happening between doctors, nurses, administrators on a daily basis. Also back-end support with the technologies happening. Because at the end of the day, doctors have to suggest an intervention, but with what? With data, right? So there's a lot of communication happening internally in every organization. So there's never a scope where doctors are replaced by technology or healthcare professionals. With technology, we can always improve our quality in terms of delivery of healthcare, and not just in hospitals. Also, if we see in pharmaceutical industries, technology is playing a key role now. With the data, they are able to provide the right vaccines. And we see with the COVID thing, the vaccinations, they were able to come up with the vaccinations with the data. So this technology in healthcare is always integrated, I must say, yeah.
Right. So I think that will bring us to back to the basic fundamentals of the healthcare, the triple M's, where the patient's outcome is the utmost important, how we treat and how we take care of the patients. Of course, with the integration of Internet of Things or IoT in healthcare, artificial intelligence, so all this will be the support for the healthcare industries to provide better care for patients. So for our MBA programs, so students will, I think the management side is important, the management part of the MBA programs that I think will provide you with the overview how to manage the systems, how to manage your colleague, how to manage the whole healthcare systems. So that is why the MBA is crucial for us to study, especially for those nurses who completed their degree and then they move forward and progress themselves in the MBA to enhance their management styles, to enhance their management skills. I think that will be one of the areas that the nurses or the healthcare professional can improve or to climb up their career ladder, right?
Definitely. And I must say, it's not only in hospitals. Our ENU MBA graduates from health management are working in wide sectors. I mean, there are a lot of opportunities for this program. Say if a nurse is taking up this program, she would want to better her skills in the hospital. And one of the good feature for our ENU MBA health management is you don't have to have a degree in healthcare. Any student from any discipline, any undergraduate degree who are keen to have a career in healthcare sector can join our program.
So can I join as well?
Yes, you can. Always welcome to join the ENU health management program, because there are a lot of career opportunities out there for MBA qualifications, like a lot of manufacturing happening in healthcare sector, equipment, because a lot of ICU equipment, a lot of surgical equipment. So ENU MBA graduates can work in the manufacturing companies, pharmaceutical companies as well, in hospitals. As we know, they work in different aspects in hospitals again, be it finance. Finance is crucial in hospitals, right? We have to able to advise patients on what best insurance they can take up and what are the best options they have with considering their age. So ENU MBA health graduates are are exposed to all this knowledge in wide areas. So obviously with a wide range of opportunities out there.
Right. So we talk about a lot of opportunities out there. Last question is that, do you see what is the actual projection of the healthcare professionals, job opportunities out there in the market?
Sure. I feel everyone would be pleased to know that there is exponential rise in healthcare demand right now. And as we can see, United States Bureau of Labor Statistics has announced that there are about 2.4 million new jobs that are going to be created in the next few years. Maybe in the next 6 or 7 years, we are going to see 2.4 million new jobs in healthcare.
Well, there's a lot of job creations.
So I encourage most all of them to join our healthcare programs to take up these career opportunities out there. And interestingly, stated by Bureau of Labor Statistics that 6 out of 10 fastest growing occupations are from healthcare sector. Besides technology, there's a lot of demand for healthcare right now.
Really a huge demand
for
healthcare.
Demand out there. Not only worldwide, if we see Singapore context alone, our Ministry of Health has announced that about 9,000 healthcare opportunities are going to be created by the end of this year, in fact. Wow. So there are a lot of opportunities, and the government in Singapore and worldwide is encouraging more and more healthcare professionals to come on board with the current challenges we are facing in healthcare sector right now.
Thank you, Amruta.
Thank you
so we hope that you have inside information about our programs as well as the demand and out of our health nursing program as well as our MBA programs. Stay tuned with us for more information for other health MBA programs as well. Thank you for your time, and thank you, Amruta,
Thank you so much, Dr. Tam,
and
thank you everyone for tuning in this session.
Thank you.
We are Edinburgh Napier University, the #1 modern university in Scotland. With our roots firmly grounded in the practical, applicable and the accredited, we give our students the very best of everything they need to build their careers. From delivering academic approach teaching to hands-on experience, we develop skills through professional know-how supported by a deep connection with industry. We facilitate the experiences that matter the most, enabling our students to succeed beyond university. Our work, our teaching and research has international reach and global impact, advancing knowledge and improving the lives of local Edinburgh and beyond. We go beyond, breaking down barriers, inviting the world in, extending and supporting our community, promoting inclusivity, championing access. With more than 250 courses, over 20,000 students in 140 countries, studying in Edinburgh, online and at partner universities around the world. Be part of an ever-growing establishment. Be part of our story at Edinburgh Napier University.